The next topic is blood volume. So it turns out that 2/3 of water, our body water, is found in cells. That is intracellular. Of the remaining 80% is in the interstitial space, and then 20% is in the blood plasma. Okay, so 2/3 is in the intracellular, found in cells, and then of the remaining 80% is in the interstitial fluid, and 20% is in the blood plasma. And osmotic forces control the movement of water between the intestinal space, or the interstitial spaces, and capillaries. So osmotic forces control the movement of water between interstitial fluid and the capillaries. Urine formation and water intake, both, which is from water intakes from drinking, also play a role in blood volume. And fluid is always circulating in a dynamic state of equilibrium. So let's take a look at some of this movement. Okay, so we have water intake from drinking, right? And that'll go from the GI tract into interstitial fluid, and it can also be moved into capillaries as well. And water also has the ability to move from interstitial fluid into the inside of cells. Now, water can also be leaving capillaries to enter interstitial fluid. It can be leaving the cytoplasm of cells to enter interstitial fluid, and then it can be actually sent back to the GI tract to help make feces. And we lose 0.1 to 0.2 liters, which is 100 to 200 mils a day of water is released in feces. Kidneys critically play an important role in producing urine, and we urinate 0.6 to 1.5 liters a day. The lungs actually release respiratory droplets having 0.3 to 0.4 liters a day. So we're having water droplets, respiratory droplets, leave our lungs that are enough water that if you put it in a flask, it's 300 to 400 mils a day of water that are released in respiratory droplets. This fact is why people have to worry about catching COVID-19 from people who are infected, because they release COVID-19 in their respiratory droplets, and we're constantly releasing these as we breathe and talk. But so basically, the respiratory droplets from the lungs is really significant. So whenever someone says they don't want to wear a mask during the pandemic, I would like to remind them of this fact that the lungs are releasing 300 to 400 mils a day of respiratory droplets. That is a lot, right? You all know that from your science lab. 300 to 400 mils is a lot of water. We also release water from sweating, and we're losing 0.2 to 1 liter of water a day through sweating, right? So this is all the excretion. We excrete through urination, through respiratory droplets, through sweating, and through feces. And if someone's dehydrated, one of the things that happens is they have very hard stool. So if any of you are parents, if your kids have hard stool, then one of the things you need to do is to make sure they drink more water. So the point is that the water is really dynamically moving around the body, right? It's moving from in and out of the GI tract. It's moving in and out of the cytoplasm of cells, in and out of interstitial fluid, and in and out of capillaries. So water is really moving around very dynamically in our bodies all the time. And one of the important things that's helping water move in and out of interstitial fluid and capillaries is hydrostatic pressure and also oncotic pressure. So let me explain those two variables to you. So hydrostatic pressure is just the pressure that is found in the blood vessels. So if you look at the, here's the capillary, here we have the arterial end of a capillary, and there we have the venous end of a capillary. So it turns out that the hydrostatic pressure at an arterial end is 37 millimeters mercury, and the pressure in the venous end of a capillary is 17 millimeters mercury. So there's higher pressure at the beginning of the capillary than at the end, as it has capillary travels through the tissue. The hydrostatic pressure of interstitial fluid is 1 millimeter mercury. So way less than either the arterial end of the capillary, and certainly even way less than the venous end of the capillary as well. So the net filtration pressure, just from pressure so far, would be 37 in the artery minus 1 in the tissue, in the interstitial fluid or tissue. It would be a net 36 movement that would be favoring movement of water out of the capillary. On the venous end, we have the 17 millimeter mercury pressure here and the 1 in the tissue. That would also tend to favor movement out. However, there's another variable, and this is called oncotic pressure. Oncotic pressure results from proteins being dissolved in fluid. So it turns out that blood plasma has a higher colloid osmotic pressure, and this is due to proteins that are found in the capillary. There's more proteins, dissolved proteins in the capillaries than there's dissolved protein in the interstitial area, interstitial tissue. So basically, the oncotic pressure of a blood vessel is 25, both in the arterial end and the venous end, and that's because these proteins cannot diffuse out of the capillary. They are stuck there. What can diffuse in and out is water. Okay, so the proteins are in there. So we have a 25 millimeter mercury pressure in the capillary, and in contrast, we don't have any oncotic pressure in the interstitial areas of the tissue. And this really determines the movement of water in and out of the capillaries. So we call the movement of water from a blood vessel to the tissue, we call that net filtration. And then when the venous end of the capillary picks up water from the tissue, we call that net absorption. So I want to show you what is happening to facilitate these processes. And here's a little equation. So we have the pressure of the hydrostatic pressure in the blood arterial end of the capillary, that is 37 millimeters mercury, right? That's going to be tending to have the water go out. Then we have the second variable is the oncotic pressure in the tissue that would also tend to pull the water out. And since there really isn't proteins in the descending in the tissue, it's a zero effect. So basically the total force that is trying to move water out of the blood vessel is 37 over here, right? And that's leading to this out, okay? Then you subtract the force for moving, the forces that would be moving water in from the tissue into the capillary. So I mentioned to you that the hydrostatic pressure inside the tissue is 1, and then that's going to be facilitating the movement from the interstitial tissue into the capillary. But then we also have the 25, which is the proteins making the oncotic pressure inside the capillary. That is also going to be leading to pulling water into the blood vessel, okay? So you can add those two together. 1 plus 26, 1 plus 25 equals 26, okay? So we're going to see what is happening. So 37 plus 0 is the pressure to be moving water out. And then 1 plus 25 is the pressure to be moving water in. So 37 minus 26 is net 11 millimeters mercury. That means that the water is going to be going out. Okay? It's a net force out. So let's say this one more time again, but on this side over here where we have net absorption. So in the venous end of the capillary, the millimeter mercury hydrostatic pressure is 17. Okay? 17 is going to be trying to basically push the water out. Okay? Then we have the oncotic pressure in the tissue, which is 0. Right? That's also going to be the fat force, if it was there, to be pulling water out. So 17 plus 0 is 17. Now, look at the numbers for basically bringing the water into the blood vessel or capillary, right? We have the hydrostatic pressure in the interstitial tissue, which is going to be 1, right? That's going to be favoring the movement of water to the inside of the capillary. Then we have the 25 millimeter mercury, which is the oncotic pressure from the proteins in the capillary. So we can add those together because it's favoring movement of water in one direction, right? So 1 plus 25, 26. So basically it is 17 minus 26, and that is negative 9. And that means we're going to have net absorption. Basically, the fluids are going to be moving into the capillary. So when I say it's water, it's also water carrying gases and other small molecules, not proteins, but small molecules that'll be dissolved in the water, right? And I just want to point out, so this process we're showing, the blood in the arterial end of the capillary, the plasma is going to have net fluid movement out of the blood vessel into the tissue. And then on the venous end, we're going to have net absorption, which is the movement of fluid into the capillary again, the venous end of the capillary. So edema can result when we have excessive accumulation of interstitial fluid in a tissue. This can result from high arterial blood pressure, venous obstruction, leakage of plasma proteins into the interstitial space, the excessive production of mucin. We can have it resulting from the decreased plasma protein concentration and the obstruction of lymphatic drainage. And this table kind of goes over a few of the causes. So the first one, again, increased blood pressure or venous obstruction. This can cause edema, right? So the blood pressure increases. I want you to go back and think about this equation that the millimeter mercury in the arterial end would be higher, and also in the venous end of the capillary would be higher. And venous obstruction would also cause an increase in the blood pressure. You can also have an increased tissue concentration, tissue protein concentration, right? So on the slide before, I mentioned that the oncotic pressure in the tissue is usually 0. However, if there was, let's say, damage to a blood vessel and proteins leaked out from the capillary into the tissue, that could also lead to edema in the tissue, right? Because it's changing this number. It wouldn't be 0, it would be higher. So this is a very important equation to kind of test your knowledge about understanding these concepts and applying them to the movement of fluid in and out of capillaries and tissues. Another problem could be decreased plasma protein concentration, right? So if that was not there, we wouldn't have that 25 would be lowered, right? And that could also lead to the reduction in absorption of fluid. And again, obstruction of lymphatic vesicles is a problem where the fluid won't be able to drain. And we'll talk more about lymphatic vessels in the next lecture. And that'll make more sense after we talk about that.